to Crash Course Biology. Today, our story begins in the year 1869 with a newborn baby named Harvey Cushing.
The youngest of 10 children, Harvey always seeked to live up to his father's high expectations. After graduating from Harvard Medical School, Harvey Cushing became known as the father of neurosurgery.
That's pretty impressive if you ask me. Even more impressive is his shockingly low patient mortality rate. Typically, when undergoing a brain operation in the 1880s, patients died half of the time, so 50%. Cushing's patient mortality rate was only 10%. But the reason we're talking about Harvey Cushing is not because of his operating skills, but because he was one of the first surgeons to operate on the pituitary gland.
Because the pituitary gland is so risky to operate on, very little was known about it.
Harvey Cushing discovered Cushing's disease at the age of 63, just a few years before retirement. He is now considered one of the founders of endocrinology as well as neurosurgery. Talk about living up to your father's expectations. So, you're probably wondering, what is Cushing's disease? Simply, it occurs when there's an excess amount of cortisol in the body. The symptoms include obesity, a fatty hump between the shoulders, fragile skin, purple stretch marks, extreme fatigue, depression, and bone loss. Women may experience thicker facial hair and irregular or missing periods, and men may experience erectile dysfunction. Cushing's disease is diagnosed using a urine test or a blood test. High levels of cortisol in either the blood or the urine may be an indicator of Cushing's disease. Cortisol is a steroid hormone. It is produced in the adrenal glands and is then released into the blood. Cortisol regulates metabolism, the salt-water balance, and acts as an anti-inflammatory. Normally, it is produced in stressful situations. Let's take a look at a feedback loop.
The hypothalamus releases corticotropin-releasing hormone. Corticotropin-releasing hormone then causes the pituitary gland to release a tropic hormone called adrenocorticotropic hormone, or ACTH. High levels of ACTH are detected by the adrenal glands, which then release cortisol. What makes this a negative feedback loop is that high levels of cortisol inhibit corticotropin-releasing hormone, which in turn inhibits ACTH, causing cortisol levels to fall.
However, this is only true for a healthy person. Someone with Cushing's disease does not have the negative feedback loop needed to maintain homeostasis. Cushing's disease can be caused by cortisol medication. Cortisol medications are used for a variety of things, including pain management, preventing an organ rejection after a transplant, and treating inflammatory diseases. Even though the body might altogether stop producing cortisol, constantly injecting it can still lead to abnormally high levels. The other main cause of Cushing's disease is when the body produces too much cortisol, usually due to a tumor on the adrenal glands. In this case, the body does not recognize that there are high levels of cortisol, so it produces more.
Treatment either includes a risky surgery to remove the adrenal tumor or stopping the often necessary cortisol medication. In either case, there is no easy way to treat Cushing's disease.
Let's review some key concepts. Harvey Cushing was a great surgeon and discovered Cushing's disease. Cushing's disease happens when there is too much cortisol in the body, either because of medication or a tumor on the adrenal glands. Some symptoms of Cushing's disease are obesity, a fatty hump between the shoulders, and severe fatigue, among others. It can be diagnosed using a blood or urine test, but is difficult to treat. Cortisol is a hormone produced in the adrenal glands. In people without Cushing's disease, a negative feedback loop prevents cortisol levels from getting too high. I hope you found this video helpful. Comment down below what disease you want us to cover next. Bye!